I'm Jude Jacob.
I'm Mary Mani.
I'm Aksa Shaji.
And we're going to talk about Turner syndrome for pathophysiology today. And we're going to start it off with background. So Turner syndrome is a genetic disease where there's a missing or partial absence of the X chromosome. As shown in the picture here, this is what the normal female chromosomes look like, and female with Turner syndrome. So basically, it's also known as 45X, and Turner syndrome is basically found mostly in girls. And Henry Turner, in 1983, he diagnosed 7 patients with Turner syndrome between the age of 15 and 25. And he actually diagnosed them with the clinical manifestation of they're usually shorter than healthy people. And that was one of the main clinical symptoms he used. So next, we're going to talk about epidemiology.
Epidemiology, which means upon people study. Epidemiology of Turner syndrome is largely unknown. Turner syndrome occurs in 50 per 100,000 live-born females, and delay of Turner syndrome exists in all population, and some are only diagnosed upon adulthood. Better care and medical treatment of females with Turner syndrome will likely reduce the increasing morbidity and mortality. Now we are going to talk about the clinical presentation of Turner syndrome.
Turner syndrome is found only in females. Their developmental delays, nonverbal learning disabilities, and behavioral problems are possible. There's a short stature that's common and characteristic webbing of the neck. Females also have widely spaced nipples, narrowing of the aorta, edema in the feet of newborns, gonadal streaks rather than ovaries, and these streaks are sometimes susceptible to cancer. Here's a diagram of a female who has short stature, low hairline, widely spaced nipples, small fingernails, brown spots, fold of the skin, elbow deformity, poor breast development, and no menstruation. Now we're going to talk about the pathophysiology of Turner syndrome.
For pathophysiology of Turner syndrome, it results in problems in many different systems. For example, cardiac system, what it does is it narrows the aorta and bicuspid aortic valve, and it causes hypertension due to that. Usually you only get hypertension when you're aging, but when you have Turner syndrome, you get it when you're really young. And GI bleeding is one of the main problems. And as you go to renal, there's different urinary problems, renal problems, hearing loss, lazy eyes, diabetes mellitus, which is one of the main problems, and osteoporosis and fracture. Even before you grow old, you start to get it. And now we're going to talk about diagnosis and diagnostic procedures.
Diagnostics and diagnostic procedures. Physical features are the first indication of Turner syndrome. During birth, swollen hands or webbing of the skin on the neck. During childhood, parents notices that the girl had stopped growing or is shorter than their peers. During adolescence, lack of breast development or menstruation. Adulthood, some women go through puberty and have menstrual periods, but they have ovarian failure. The diagnostic tests that indicate Turner syndrome is karyotype analysis and ultrasound test. Karyotype analysis is performed on a sample of fluid removed during amniocentesis. The test will indicate whether the X chromosome is fully or partially missing, and the ultrasound test will indicate if the person has features that is associated with Turner syndrome, such as heart failure or lymph fluid on their neck, around their neck.
And that picture, it's showing before birth, you could actually test for Turner syndrome, and that picture is actually showing the amniocentesis she talked about, and that's how you check for Turner syndrome before birth.
Now we are going to talk about the treatment and prevention of Turner syndrome. Although there is no cure or prevention for Turner syndrome, treatments include human growth hormone, estrogen replacement therapy, human growth hormone, which would increase the height of the person, and estrogen replacement therapy, which would help start the secondary sexual development such as breast development and wider hips. Regular health checks and access to a wide variety of specialists are important to care for the various health problems that can result from Turner syndrome. Now we're going to talk about the psychosocial and economic impact of Turner syndrome.
Adolescent girls with Turner syndrome are at a greater risk for having problems related to lower social activity, poor social coping skills, and increased immaturity, and hyperactivity and impulsivity compared to their peers.
Girls with Turner syndrome have more difficult maintaining relationships, and they tend to have less friends, and they're more socially isolated than other people. And it's basically not fair. It's not their fault they have Turner syndrome, and since there are treatment, but it's not curable. So it's socially not fair for them.
And economically, the mortality in women with Turner syndrome is threefold higher than in general population. It is raised for almost all major causes of death and is raised at all ages with greatest excess mortality in older adulthood.
Now we're going to talk about future consideration. For future consideration, basically there's nothing the father and mother can do to prevent the error from occurring.
The only future consideration you have is to detect the disorder before birth.
Cross-model, longitudinal, randomized clinical trials and other comprehensive studies designs are there basically to test for Turner syndrome. For example, before birth you could check for neurodevelopment, endocrine functions, and medical status and cognitive outcomes.
These studies will hopefully aid us in developing syndrome-specific interventions, such as what Maren was talking about, that will improve functioning and quality of life with individuals with Turner syndrome.
And these are our references. And that's it. Thank you so much.